Yeah. Just again.
Just came for this time. We don't have to make sense this morning. I'm gonna guess that.
Let's go ahead and call the order. I'm going to call the Health Planning Council meeting to order now. My name is Donna McClintock Foss. Welcome all. And our first business is the approval of the August 28th, 2025 meeting minutes. My copy has 2005 on the written version, so I'll just note that needs to be changed. Are there any other additions or corrections to the minutes? Okay, hearing none, seeing none. Okay, the minutes will be approved as submitted. Our next business is the new business, and I'm going to introduce Martin Krasta, who's going to speak on the Rural Health Transformation Project.
Hey, good morning, everyone, and thank you for being here at the Health Planning Council. Today, we're kind of going to go over the Rural Health Transformation Program. What this program was an opportunity for funding came out through CMS, and it was created through the from HR1, the One Big Beautiful Bill, which allows for $50 billion for all 50 states for the next 5 fiscal years. So potentially, we're looking at $100 million for Maryland. For potential funding. So MDH has came down with a request for information for us to provide today at the Health Planning Council. So what we'd like to do today is kind of just go over what we'd like to see from this potential funding for this bill. So that could be from anything that we think that would be beneficial for rural health initiatives in our community. So today we're going to kind of go over, Shelly is going to join me, and then we're going to kind of run through. MDH has created a template for us to kind of go through, and it's kind of an open discussion so we can see what we'd like to see for funding for this bill. So,
does anybody have any questions about that bill? Is anyone familiar with the bill? Everyone, I'm seeing some heads. All right, we have a lot of qualified partners in the room, so thank you for coming this morning for that. So, like Martin said, MDH basically provided us with a template, and we're going to go through several questions. I'm going to just run through them first quickly so you know the order, because we want to make sure we get as much discussion in as we can in the time frame. We did this at the local management board last week, and it did take a long time, and which is really good, really positive discussion. But so the first thing we're going to do is talk about what's working well in Garrett County, and they give you several different themes. And so we can talk about those themes. The next question is about the challenges that we face in Garrett County. And then the third one is the future. So they want us to think ahead, and they want us to just envision what a healthy community looks like in Garrett County. And then the fourth thing is really to identify and prioritize these themes that have been selected for us. So that's an important point. This was given to us, and we have to fit inside of the mold for the grant and for MDH. So just so you have an idea of how we're going to do this, John created this wonderful, basically it's a Google form. So we encourage everyone to, if you're not familiar, you don't want to speak up today, or even if you do speak up and you want to make sure your voice is heard, there's a link. You can go there. You can do this yourself. You can do it for your organization. You can do it for your programs. And so we encourage everyone to share it and to do that as well. So the Maryland Department of Health is requiring us to submit this recording, and along with all of the communications, all of the discussion that we have this morning. So that is your fair warning. It's recorded, of course you know that, being at the Health Planning Council, but it will be set on, and they will hopefully watch it and then take our consideration. So it's a wonderful opportunity that we've been given to let them know what we need.
Yeah, but it'll be extremely important in just shaping the funding for these grants when they are awarded, and timeframe is December. It should be decided.
So like most funding, it's a quick turnaround. This part anyway. Okay, so
Kelly, can I just maybe ask a question and clarify something? Because I've probably done 4 of these so far.
okay,
But it is the intent of all this is this will be aggregated for the state of Maryland.
correct.
Yes.
This is not specifically just Garrett County, but this will be part of the whole state of Maryland application for the Rural Transformation Grant.
Right.
Cool. Okay, just so we're seeing a lot of surveys come out. And we're like, where is this one navigating through? So I just want everybody to understand this is the Maryland application.
Thank you for the clarification.
Cool.
It absolutely is. Of course, though, they're asking for Garrett County's voice.
Yeah.
Yeah, and to follow up with Brian's question. So there are different definitions of rural, and are they using the federal definition or are they using Maryland's definition, which Maryland's definition is really broad? I mean, it includes Baltimore County and places like
Yeah, I think that's still to be decided.
So Jennifer,
So they are allowing the states to define what rural is, but they will evaluate what that state's definition is of rural, and that will count in their points and how they score the state's application.
that is a very good point. We are positioned well.
Yeah, we will meet the definition no matter what.
So ready to get started? So John, if you want to just scroll down for us a little bit. So here are the boxes that they sent. What is working well in your community to support your health and the health of your neighbors? So it's a check all that apply. And I think that everyone can read that, but I'm going to go ahead. Strong social cohesion, a sense of community. Is that working well here in Garrett County? I'm seeing some heads nodding.
that. I think-
Yes,
Let's say yes.
yes. All right. Volunteerism, mutual aid, neighbors helping neighbors.
Yes, yes.
If you have something different to say, Dr. Cook, now is the time.
There is a
Yes.
very large text box under each question where we can provide any notes. So if you guys have any specific feedback, we can also make sure that that gets flagged in our submission.
So in a previous discussion we had, there were some different opinions about this. So volunteerism, depending on the specific community in Garrett County, is strong versus there are some communities that don't have that cohesion and the volunteerism. So it depends on where you're at within the county. So that was a nuance that we teased out. So I'm seeing some heads nod. Do we think that that's true? Yes.
Yeah, I mean, my perception, the opportunities are many, and the community comes together for, those opportunities seems to be great, and I know Judy and others are creating new opportunities, and it's there, and people jump in when needed.
Anybody have a different perspective?
I do. I think it's looking at it from the school's perspective and all of the different schools in each part of the county. There may be opportunities, but there may not be the people that volunteer in that community because of socioeconomic problems, because they're dealing with their own, problems at the time, or they don't have the ability to volunteer that they would like to. So those communities, some need more help than others and need outside volunteerism to get them going and spark that.
So that's a very good point. Thank you, Becky. So poverty is a
Yeah.
huge barrier for us. People work multiple jobs, they have their own struggles. And so levels of volunteerism and then finding champions within those communities to lift others up. Okay, so moving on, local nonprofit or faith-based support. So we can add details here about specific organizations in our notes section that we feel work well in Garrett County. So we have so many of these, and we have a very strong faith-based support system I'm gonna let you guys, I'm just gonna open it up and John's gonna do the typing for us. Just start throwing out your churches and the organizations that you know do so many things.
I think Cindy's fund should be right. I don't know any place else in the country that really can pay everyone's bills. You know, and they're amazing.
So tell us a little bit, tell us
Right.
a little bit, if you don't mind, Bob, about Cindy's fund for the notes.
Well, it's totally volunteer, private fundraising, and they give individuals, coordinators who work with the people who are newly diagnosed with cancer and provide all kinds of supports, including gas cards, helping to pay with bills, but also just social supports as well.
Thank you.
We just had a patient for home health services that Cindy's fund paid for the patient to have a private pay caregiver, which is huge.
Right.
No one in this county can afford private pay caregivers, but the need is so high. So for Cindy's fund to come up and do that was amazing for that patient.
And that doesn't happen. I don't think that happens anywhere else in the country.
No.
Okay. So the mechanism that they do that is just a lot of fundraising, and they have all sorts of events throughout the year that we go to, we support, and they do a really creative job at getting people to support Cindy's fund.
And I'd also have to say, and then throw hospice right in there too. Hospice is, there are other places that have hospice, but it's the same support. Those are that relying lots on volunteers.
For fundraising and for volunteers that actually go out in the homes,
Right.
And really provide comfort and support for people that are in that situation.
Anyone else? Any other organizations?
I guess community action is in there with all their services. So
We had Christian Crossing.
Christian Cross.
Larry, for the recording, what's Christian Crossing?
Well, Christmas Crossings is an organization that takes in used clothing, used furniture, all kinds of donations, and they have a thrift store that they sell these items out of, and then they donate to a lot of people to help them in crisis situations. They donate to Cindy's fund, and I honestly can't remember all the organizations that they've given money to, but like Cindy's fund, I think they gave $10,000, and several other organizations that they've given money to. But they work with community action, people that are maybe behind on their rent or need something, just need help with anything that would create a hardship for them. So they take in a lot of stuff. There's a lot of people that donate to them. Can't imagine if you've never been into that store, but they give a lot of money. A lot of money.
In addition to what Larry said with Christian Crossings, they also had a dental program for a while too. So dental is an area of need, not only in Garrett County, but in a lot of rural areas as well. And Christian Crossings provided funding for individuals to receive dentures, for transportation to and from dental offices. So that was a really nice component of that as well.
Transportation, what's that?
Dental treatment. Yes.
Other organizations.
I think we should highlight Ruth Enloe Libraries. What they do for our communities is profound. I think what opportunities they provide within our communities of all ages is great. It just seems like they kind of see what's going on in the community, and then they try to figure out how to bring those resources to people. I just saw that they're doing pickleball sets, like pickleball sets, which I think is great with all the stuff that's happening with that. And then I think it's also, when I look around
Okay, can anyone hear us? Okay.
Yeah.
Well, just make sure you speak loudly, because we lost our primary mic.
Any other faith-based? We move forward.
I'll highlight some things that I know since people aren't starting at Laughlin Church of God. There's all sorts of outreach ministries that are provided, from giving away of coats, school supplies. There's always, every month it seems like there's a different kind of outreach opportunity. All of the little, and this is what I know across just many churches, are the different small groups that are created, so that people can get connected on a more personal level, from the different, again, Crossroads Church seems to always they try to find a need. The kids camps that they host are fantastic. Same thing with Faith. Their sports themed camps. Again, those that do food outreach. I know that list is pretty extensive across the county as well.
At the hospital for the crisis patients, several churches donate like backpacks for the homeless patients, blankets. I know the Methodist Church is one that does.
And you're speaking for
The hospital,
GRMC.
GRMC.
And can you talk a little bit about the crisis services?
So the crisis services GRMC is in our emergency department. We see at least 30 patients a month that are in different types of crisis. And our goal is for a safe discharge, whether that means inpatient treatment and a transfer from our hospital or outside resources. And we provide contacts, anything that we have the power to provide to help them do well. So except for the homeless population, which we are seeing more of at the hospital, we will give them, if their choice is to remain homeless, we will provide them with backpacks, blankets to keep warm. Or if their goal is to go to a homeless shelter, we will provide transportation or means for them to get to a homeless shelter.
On a different aspect of this volunteerism that I see a lot in the community for home health is, like I said, large entities like Comfort Keepers and ProCare and all that, patients in this community can't afford that type of private pay caregiver service. And that's kind of like, that's people coming in and cleaning your house, getting groceries, light meal prep, that kind of stuff. So we have a huge list between us and heirs of just, a lot of them are from churches, just people that do this out of the kindness of their heart for people in the community. And it's, like I said, it's huge because it's such a needed service. And we keep that running list. And if anyone knows of people that kind of do those things on the side for people in the community, let myself or Elaine know and we'll add them to the list. Because it's people that volunteer just to go over for 1 or 2 hours and do this person's laundry. And it's huge for the aging population, definitely.
Okay.
I think the Habitat for Humanity, they have presence in Garrett County helping with housing needs.
And I have one other thing that I think is important to highlight, especially in Garrett County, is first responders with our volunteer fire departments, the rescue squads on both ends of the county. I think that's something that's would create a very high need for people if it wasn't a volunteer service.
I think James Isaac's house needs placed on that list too. I mean, we could sit here. I'm just like, I can start in Oakland. I start this little map in my head, and I could go the whole way around the 360 of each pocket community. There's in 1 year, I can work with 100 different volunteer organizations that will spread messages or help in many various ways. So
Yeah, you could take the simplest of nonprofits, like, one that's new, but, I utilize personally a lot is Kindness for Kira. I don't know if anyone sees that in the community. It's new, but Dawn is doing huge things. Her Kindness for Kira Day in the Park was in September, and all of the money that she raised went to James Isaac House. She picks it different, and she's just a mom who lost her daughter that is doing this for our community. I know she's done, I think she's on the school system. I know she's on the Dove Center, and then this year she picked James Isaac House. And I know like just for like us, like my husband does a fundraiser every year, and we put money toward Kindness for Kiera, and then she puts that toward whatever she wants to do. So just the nonprofit and the helping is huge in this community.
Samantha's library and Samantha Humphrey Arts are also two huge ones.
For the sake of time. Thanks for the summary. Thank you for all of that. And again, this is available. So as you're thinking through it, please get on and list your organizations. Okay, so
I would like to second home health because this ergonomic situation is going to require physical therapy.
okay.
So
So we'll
I say
check
we
that
check
box.
that box.
Yes. So strong public health or healthcare partnerships. Standing in the room, looking around. We've got our federally qualified health center. We have our hospital. We've got public health, and we're working together.
I'm strong.
Creating community-led solutions. Excuse me, creative community-led solutions.
Well, I think a lot of that you just outlined.
Yeah, it's in the volunteer section.
Yes, we'll check that. Effective outreach and communication. Yes.
Hi, I would say that we do, I'm Kenzie Noosh with University of Maryland Extension, and I'm the project leader for SNAP Ed. And I would say that we do effective outreach, but a lot of our programs are receiving funding cuts right now. Like we were just told that our entire program was losing funding because it's a federally funded program. And we are different from EDT dollars, SNAP benefits. We're more the educational piece. So we actually go into the schools and educate on healthy living and nutritious eating. And we reach, we have over 7 different schools that we go into. We work with community action. And so we, from University of Maryland Extension, are committed to keeping this health and wellness going. So we are trying to find any way that we can keep the program going, even if it's not under, even if it's just under health and wellness. So I think that the outreach is out there, but right now we're struggling with challenges to find funding for it.
Thank you for that. It's just every day.
Yeah.
We meet more people from our agencies. We've had to say goodbye to colleagues and friends. Just yesterday, I had to do that as well. And so we are in a very unique time in public health, and a lot is changing very rapidly. So it is important to think about leveraging funding and thinking about just reshaping and how we pivot amidst the change. And so this exercise helps us prioritize what that looks like in our community.
I don't know if that works under that or not, but
it's an important point. Thank you. So back to just effective outreach and communication, right? It just depends on what side you are. We've had a lot of different discussions about this, and it is difficult to reach the masses with just timely information, especially about programming or different things. And our algorithms, right, really just put us in these boxes, if you will. And so I think it is a challenge for every community to have effective communication. But we do rely a lot on our network, our social networks here. And so I think we always say this is like a half check, right? Does anyone have anything else to say about that piece? And what we're doing well, just given the conversation we're having right now.
I would say, when you say half check, yeah, I think you're doing an amazing job with, websites and things like that. But the challenge that we have, and I think they have a challenge everywhere, is newspapers. I think of the good old days 10, 15 years ago when on Thursdays you pick up the newspaper and you learn so much. We don't get that anymore, and I'm sorry, but we don't have that print media that used to be there. And also, the Time News had that, the Weekender. There's very little in the Weekender. Thank you for getting information in there that's in there, but there's just not as much. It's not as compelling as it used to be.
And that is a really important point too, is the Weekender is closing their operations at the end of the month. So in terms of how we do outreach and how we do communications, the one print vehicle that goes to every household in the county is no longer an option. So, from my perspective, Becky and I had this conversation, trying to brainstorm some ways that we can get around this. But I think that is such a critical hit to us in terms of how we do outreach, particularly in communities, because we might have these physical presence in a lot of the programs that we're currently operating, because those are sort of prescriptive elements, but those may not be there in 5 years and down the road. And what does that look like? How do we do outreach to Kitzmiller and Friendsville and these areas that just don't have the same level of built infrastructure? So I think that's a really important point, and just making sure we level set for what's available and what won't be available as we head into October. I think there was a
Sadie?
Should we take the back now?
Were you calling on me?
Yeah, did you have your hand up, Sadie?
At one point I did. I was just gonna talk about what John said about the weekender. So that's why I took my hand down.
Yes, and if anybody wants to put anything in the comments, we will get those at the end, and then we'll put them in to the survey. So just, yes, you can also use that as a vehicle too.
So the next one is culturally responsive care or services.
We decided we're checking that.
Oh, we did not. We're checking the box or we're not checking the box for effective communication.
I don't think half check is an option here.
I know.
A quick turnaround. We're not-
I think
developing another form.
probably, like, if we check everything, we look like we're perfect.
Yeah.
So we shouldn't be fearful not to check something, so that we can say, here's where we need to improve. So if this is one that we're not all like, hell yeah, it would be okay not to check it.
That'll be the skill next time.
Yeah.
Okay, so in agreement of not checking the box, seeing heads. Okay. So now culturally responsive care or services. General thoughts.
I think that's probably a yes and no also. Like it's kind of, I think that the diversity of our county is kind of limited. And I would say our diversity is economic, faith-based, but racially, all kinds of stuff. We don't reflect what you see around the state. And that's not necessarily intentional. It just is what it is. But do we react to our cultural differences for the ones that are apparent to us? We have, faith-based practices, non-faith-based practices. We've got, do we have areas for those that are economically challenged? All of us, just about everybody takes Medicaid, so that's not an issue, but that will become an issue. So, but, for other things like for those who are not, white Anglo-Saxons, or do we feel we have that diversity and enough services to supply that? Probably not, but that's not to say anyone's excluded either. So I kind of struggle with that, because all are welcome, but we just don't have it. Our diversity is a little bit uniquer in Garrett County than Baltimore City or something like that. So do we react appropriately to our diversity? Yes. But that's, what is everybody else?
One opinion. Thank you for
I
sharing.
think
that.
this is always going to be an area that we're working towards. Because I know just from the hospital perspective, we're always looking at taking preferences into account for care, because we get people from all over with our tourism industry. And so, you're always looking at that. I think it's always going to be an area we're striving to meet everybody's needs for. Like, what are your preferences for your care? Just all kinds of different things. So that's always going to be an area we're continuing to evolve into.
In your hand? Sadie?
Yes, in terms of diversity, I think we've come a long way, but I still don't think that we're there yet. I think because we don't have a diverse community, people don't know how to react when there are different diverse people in the community. Like I said, I believe we've come a long way from the time when I moved up here from Baltimore in 76, 77, that there were no African Americans in school, to now where there are some, and we have Hispanics and things. But I don't think that we as a community have enough diversity to help us engage with people of different cultures.
Yeah, I was thinking the same thing. It's an we do a good job for where we are, but it's the emerging group that there is we are changing slightly, not like most of the rest of the country, but we are changing, and I worry about those folks who see themselves as different, and not being able to feel like they fit in and get the support that they need.
I will just say, from an assessment standpoint, when we've done focus groups, we have had a lot of discussion around these topics in our focus groups. And for those that don't feel like they belong, they really don't feel like they belong.
Right.
So it's incredibly isolating for people that look different and think differently here, based on the assessment data that we've collected.
Right.
And I think we need to be very aware of those challenges and our friends and neighbors that don't look or think like us.
So there is one group that has grown in diversity in Gary County, and that's the LGBT plus group. And, that's an area I think that we can continue to improve, because there is a growing population in Gary, and services are very good.
Right.
Okay. We're checking the box, or we're not checking the box? I'm leaning toward no, we're not checking the box. Okay. Work to do. Access to local.
Let me weigh in on this though for a second before you check or not check that box. If this is going in statewide, they will interpret that as racial. That it's their lens for diversity does not reflect us at all. And if you've ever been in any of those meetings, the way they throw programs at it is just to say, we're going to put more money into, and it's specifically say, African American, Hispanic, and will sometimes give lots of money, and then you go to the local counties, Garrett and Allegheny in particular, and say, okay, so what do we do to reach that group that they believe is an African American church? That we have this community, and sometimes we have this very diverse community that it's kind of spread out. So it's really hard to address that when the state provides the funding and puts restrictions on it, on how they see that. And so that's the concern I have with that. That I because we are very nuanced in where those issues are. So
they're thankfully, because of the way that this is, they are taking into consideration all of the notes.
Right.
And so I think that
And recordings.
And so
Okay.
I think that just the general idea of our conversation,
Right.
we've explained some of those things. I do want to address, let Lorena.
Yeah, no, I was just gonna say, I fully agree with Bob. I would say that the caveat is you need to allow the local community to address, the gaps that they see in diversity. Because what is good for Baltimore City or Montgomery or Annapolis or Eastern Shore is not good.
And it is frustrating to have these boxes to have.
So you can check it if you make sure you have that and put it in bold and underline. Let us define what that means rather than the state, throw everything at the wall and see what sticks.
Oh, someone has their hand up. David?
Yeah, I just want to add on. Bob basically went right to where I was going. I just want to say that we do have culture. and it's Appalachian culture, and it's related to West Virginia, Pennsylvania, and our region. There's a larger regional culture that we're a part of. And I believe that many of the organizations work appropriately within the context of that culture. And in my comment in the box, I just was like, it would be great if we could get some recognition around diversity to include that specific kind of diversity, which is what Bob was talking about.
Yeah.
Thank you, David. All right, I'm seeing a lot of heads. I'm shaking heads, yes. And so
Hopefully there's not a character limit on the spots. Let's keep going.
we have another hand.
Good morning, everyone. Thank you so much for being here. My name is Sarah Seitz. I direct the State Office of Rural Health. So some of this information is coming to us, and I just wanted to offer you what other jurisdictions have done is really they're only checking that box if it's a topic that came up in conversation. So if this is not an area that, as you were talking about potential challenges, you said, we're not doing this. If that wouldn't have come up in a free flow conversation of challenges, you certainly don't have to check it. I can assure you that we're not reading deeply into what may or may not be there. If that's helpful at all to your conversation and going through the additional questions as well.
This is very helpful. Thank you. Okay.
So, where is that?
Let's see a show of hands in the room for a checking box. All right.
For us, we are.
Okay. So Brian is the bold one.
I'm the election.
Who said yes? Do people agree? Based on what Sarah just said, online and in the room. Are we doing that? To the best of our can, to the best that we can.
David said, okay, there's yes or no's.
On your perspective, as you said. We might think we're doing well, but maybe we're not.
So we don't have a scale on this question. So in thinking about the context, I think is important, right? So like when we were on nonprofits, everybody was, to Brian's point, the scale was hell yeah. And now the scale is yes, no, there's some like bobbleheading happening. Does that impact whether we check it or not?
John, can I just say, I want to point back to what Bob was saying about when we commit to, we put certain things in there, then there's a measure that comes out on the other side. And the way that culturally responsive or diversity gets measured, the context is really different downstate. And Bob was really pointing that out, and that sometimes our results and our reporting can be looked at in a negative light because of the lack of specific racial and ethnic diversity. So I just think Bob said a lot of good things.
So we have the comments, and you know, this can also be used for more than just this one activity. This is an assessment activity in general. So this is important to our broader community health needs assessment, ongoing processes, and all of that as well into the community health improvement plan. I just want to remind everyone what the question is. So what is working well in your community? So is it working well? Do we check the box, yes or no? We are hitting time.
I'm saying no because of the, even though before I was like, yeah, you know, but after it goes to what David said with the Appalachian culture, you know, that if funding follows this, it needs to be, you know, respect that the Western three counties have an Appalachian culture that the rest of the state doesn't have. And so when you say culturally responsive, sometimes we don't have that.
So I would say we leave it blank, and then I think we've made a lot of comments to explain kind of our backgrounds and how, you know, with, that question in particular.
I think in the broader context, the answer is further ingrained. So, we're almost done with question one.
Right.
Shelley, we're not gonna get to your 360 thing, by the way.
We're gonna do it a little bit different for this next question. But this is very helpful information. So, access to local health programs or clinics. Do we do that well? I see some people saying no. Very discreetly in their chairs. So we have room to improve with access. We have a lot of programs. We have a lot of different people doing different things to help promote access. But the challenge is people don't always know about it and can't get to it. That was the local management board synopsis of this question. I may just share that with you. And I see some.
I think when you think health, it's medical, mental, dental. And when you look across all of that, we are lacking a couple of, particularly dental is a growing need out here. And we always say it's not enough behavioral health. So
That's because we have a hard time attracting,
Yep.
professionals in the area.
Yeah,
That brings
I
us,
would
that
shorting
brings us
here.
into our next question. Thank you, Rodney, for the segue about some of the challenges as it relates to what we do well.
And I think that one's data driven too, that when you look at the comparisons, when you look across counties, we always have fewer providers per thousand of all the three of those categories. And we're on the very low end of that, even though we have great providers, we're on the very low end.
Yeah, can we add vision? That's an important one.
Yes.
Yeah, we're on all the HRSA lists.
Right.
We collected them all.
Yeah, we're medically underserved area.
All right. And then,
Can you add specialty care?
Yep, I sure.
Just, I mean, more and more is coming to this community, but from a home health perspective, like patients can't get to their urologist, their cardiologist, their endocrinologist. It's all 45 minutes away, which, leads to hospital readmission and so forth.
This is great asset mapping. We're already getting started on the 2028 community health assessment. So to the question at hand, access, are we saying that is not a well? Okay.
food security initiatives. I feel like I should recuse myself from this one. We're doing it well. We're making tremendous progress.
Yes.
Yeah, we're making growth.
But we're not there yet. So I vote we check the box.
Well,
Or no, we don't check the box. Excuse me, don't check the box.
I personally think it's gonna get worse because, we're going to have fewer and fewer people with insurance and ability to pay. And, I know Mountain Laurel does a great job of getting people on a slot in Eastfield, but if you have to drop your insurance and you're thrown off Medicaid, how are we gonna serve those people?
So just one more, access to mental health resources. So we've mentioned it before in the last discussion. We have a lot of room to grow here.
Yes.
And so
Leave it. Don't
not
leave it.
check.
Don't check
We
it.
will not check that one. Yes.
Do not check it.
Any other things that we're doing well that they didn't provide themes for us to talk about? Anything that is an outlier that you think, oh wait, we need to add this to the list. We're doing this well in Garrett for the sake of the recording.
We have the only home health agency in the county.
Okay.
Right.
So instead of going through each box, because of our time, for question 2, we're going to look at the entire, we're just looking at all the boxes at once. Thankfully they fit on one screen. Thank you. And what challenges you or your loved one face. So let's just maybe pick the top 3 here.
We can kind of tie it into what we've already been talking about. I think a lot of it we've already kind of hit on. So, I mean, whether it's food insecurity, lack of specialty care, long wait times, lack of insurance, I think are some of the huge ones, especially also a different one we haven't really touched on, lack of transportation. I would say that's huge for us. I mean, just
Housing insecurity. limited jobs.
Yeah.
My cost of care,
Get a list.
provider shortage. So I'll throw one thing out here as well, because it's something that I've heard repeatedly that I don't know that we've documented yet, but it sounds like one of the things that's a common thread is just a lack of built infrastructure.
Yeah.
Does that, maybe some comments that we want to put in there?
Digital access.
Can you please point out something about youth aftercare? Like there are no rec centers, there are no things like that for our youth here to connect them back to all of these things and life skills.
What was that?
Just
Rec center.
youth rec center, like youth. things
Services
youth.
for the youth.
Youth services, yeah.
After school program, yeah.
After school program.
Get that progress. Any other comments?
So yeah,
I think I know daycare has been a big deal.
child.
Is that childcare?
All right, so this is the fun one. And then we're gonna, before we do this, we're gonna scroll down a little bit because we do have to prioritize. So just be thinking about this. These are preventative focus, community-led, cultural relevance, and trust building. So these are the funding areas of the grant. And then if you just want to scroll down a little further, they basically want us to prioritize these things. So sustainable access is the first. The second is workforce development, innovative care, and tech innovation. So as we move through in just the next few minutes, we have to think about how we're going to prioritize what we've talked about in those categories. So let's go back to the future question quickly and do the same thing as we did for question 2. When you think about the future of your community, what does healthy rural Maryland look like to you? Check all that apply. So it's actually pretty easy.
Yeah.
It's all of them. Unless someone has other things to say.
They didn't put anything about food. Sustainable and access to resources for all community members.
I think really all of that ties into your prevention focused systems, because when you're looking at the health overall, disease, chronic disease, mitigation, how do we promote healthy lifestyles, pick up on screenings, cancer prevention. When you look at your highest cost services, it's cancer care, it's cardiac care, it's diabetes. Like if you can link all those in, if people have jobs, if they have access to healthy food, if they have a place to stay, they're more apt to take better care of themselves, which will then promote a healthier Maryland, a healthier Garrett County. I know just looking at, that's one of the areas, like we're really thinking outside the box, prevention. Like it's not anymore, how many people can we get into the hospital? What can we do to keep people healthy so they're out of the hospital, starting in the school system, screenings into young adults and to young women, going on the road, taking screening to the local communities that don't have the transportation to get there, getting the mobile screening unit and going to those communities just to get that outreach. So I think all of that really ties into, health maintenance and wellness.
Thank you. So that's a nice segue. If we don't have anything else, it's a really nice segue into these 4 areas.
It's 5 areas.
5, thank you. So again.
One was rural health, ever particularly helpful.
We gotta make it healthy. That's our mission.
Right, we have a lot of barriers.
Yeah, and it's always been that way, but we're trying to overcome those.
Yeah, break down the law.
Mhm.
Get out where the people are.
Does anyone have?
We make rural health healthier.
Jennifer, do you happen to have the definitions of these areas? So we kind of read the general definitions with the local to help us understand what they're meaning by preventative focus and community led. While we're waiting on that.
I have it.
Okay, great.
So for Make Rural America Healthy Again, support rural health innovations and new access points to promote preventative health and address root causes of diseases. Projects will use evidence-based, outcomes-driven interventions to improve disease prevention, chronic disease management, behavioral health, and prenatal care.
We need all that.
Yes, please.
This is a prioritization section though.
So that we have some others.
Sustainable access, help rural providers become long-term access points for care by improving efficiency and sustainability. With RHT program support, rural facilities work together or with high-quality regional systems to share or coordinate operations, technology, primary and specialty care, and emergency services. In workforce development, attract and retain a high-skilled healthcare workforce by strengthening recruitment and retention of healthcare providers in rural communities. Help rural providers practice at the top of their license and develop a broader set of providers to serve a rural community's needs, such as community health workers, pharmacists, and individuals trained to help patients navigate the healthcare system. And innovative care. Spark the growth of innovative care models to improve health outcomes, coordinate care, and promote flexible care arrangements. Develop and implement payment mechanisms incentivizing providers or accountable care organizations to reduce healthcare costs, improve quality of care, and shift care to lower cost settings. Tech innovation. Foster use of innovative technologies that promote efficient care delivery, data security, and access to digital health tools by rural facilities, providers, and patients. Projects support access to remote care, improve data sharing, strengthen cybersecurity, and invest in emerging technologies.
I know it's difficult to absorb. I realize that, and we need all of them, right? We really do. And they all work together, as Kendra mentioned. But they do want us to highlight the top 3 themes. And they want us to really choose an area. So when you're thinking about it broadly, the prevention piece.
Prevention, number 1.
I agree. We also have the access, sustainable access, long-term viability. That kind of gets to John's point about infrastructure and thinking if we don't have the infrastructure, then we do the prevention. So there's a double-edged sword there. And then workforce development, there's always a resounding yes. Is at the top though. And then the innovative care, the home-based, all of the navigation, value-based care, and then the tech innovation.
I think it's access to care.
Marina.
So this goes back to what Bob was saying. If it's not community-led, it's going to be very difficult to do a lot of this. And if they give you funding, right, each community should be able to have the autonomy to decide how they need to spend that funding to address the needs of their own population.
So can you, it says check all that apply. Can you check who in that first group? I mean, when I read that, it says check all that apply. So preventive, focused, community led. Can you check both of those?
Yes. I think the idea is that we can check, we can do whatever we want here. The idea is that we, in our synopsis, when we send our report to the state, we do have to have a few decisions made.
Right.
Preferably.
So community led, preventative focus.
Right. I think those two can go hand in hand.
Anything else in this category? Seemed like we had some assets and trust. We have a high degree of trust. Sustainable access.
You know, that's sustainable access is huge because patients here don't have access, like I said, to specialty providers. If they're coming out of the hospital, they have all these follow-ups, with multiple different specialties, but they're all, in Morgantown or Cumberland. I mean, we have patients that come clear from Allegheny Gen or John Hopkins, and they can't make it back down to those appointments. So then that, that drops off on specialty care. The primary cares here are amazing, but they can only do so much, especially with the prevalence of cancer in this county is huge. So our geographical location is terrible for sustainable access. I mean, that's huge.
So,
and then there's no transportation either for them. Like if they can't drive themselves, don't have family to take them, we don't have transportation to take them either to go.
In thinking about the whole pipeline of that, because this will eventually hopefully be funding.
Yeah.
And how that can be used. So one of the things that's on here is partnership models. And I think that that is a huge strength of our community with GRMC and what they're able to do. And I think that, looking at the needs that we have, that might be an area that we would want to prioritize as an option, is that, because that continues to come up in every single conversation, is that there's just not enough. That was what happened in our meeting with the local management board as well.
Or it's just not coordinated together. Jamie has her hand up.
Amy?
Yes, the cultural relevance is also something that I noticed in the focus groups was, with the location that we're not having, the rural voice heard here in Western Maryland, we may as well be a sixth finger. Just the cultural relevance in that aspect being so rural. I know that was a big focus for in Grantsville, particularly with one of the gentlemen there, but everybody kind of agreed with that one.
Okay.
Can we look at the workforce development for those of us who are constantly recruiting for LCSWs, and the college has been great with opening new programs, the imaging program and all that kind of stuff. But that we need to have a pipeline of people coming into this community on the professional side, the technical side, so that we can continue to grow and feed what we need because of the transportation issues, et cetera. So
that's also the one that scares me to death when we look at our
We need sustainable funding for the workforce development because we can develop people. Hard thing is retaining them. And like if you look at CHW, there's not really a sustainable funding model for those positions. And so you can train as many CHWs, but other than the MD PCP plus program, there's no reimbursement for that. Well, even if there was reimbursement, they probably wouldn't cover the costs. Right, exactly. Right. I mean, it's like the peer support specialists. We need them. We have to have them, and then they make them reimbursable, and it doesn't cover the cost of having them as employees. So people leave.
And that's where the professional development, can we offer more programs?
Exactly. Right.
We have a creative RN program. We have
Starting in your school system,
yeah.
moving them up from there and
Agreed.
offering them the retentions and the perks along the way to get them through and keep them.
Right, because clinical staff all requires CEUs, supervision, and that all takes multiple staff time and money. And then they're not billing at the same time that they're doing those things. So to be sustainable, there has to be supplement. Yeah.
So in our conversation, would we agree that's first or second? Because we have to prioritize.
You don't have the people. You can't do
anything else that you want to do. If you don't have money, you can't do anything.
And our population is rapidly increasing.
Okay.
I'm sorry. No, that was you paid for the data. That's why. But I also don't want to lose the comment. So we did have a comment about cultural relevance, and it was that it's carrying through the comment that Bob mentioned as well. So in terms of this, do we want to have some sort of comment in there about aligning funding with the culture that's present? To roughly summarize that.
I think that's a really good suggestion.
Yeah, I agree. It's the Appalachian culture. It's different and it requires different.
Vanessa?
Hi, good morning. Thank you. Speaking of CHWs, the community health workers, and the need for understanding the Appalachian culture, they are the people right in the communities, and that's a huge strength to have them be part of it. I agree with what you're saying. The sustainability is tough. Statewide and even nationally, they're looking at how do they compensate community health workers adequately and keep them trained. And it's a really hard position to keep filled. It's often seen as a jumpstart to something else, where we really want to keep our people and be able to pay them enough to keep them around so that they continue with that service that is really knowledgeable for specific areas. And so that sustainability piece, whether it's someone who's trained in a medical field or whether it's someone who's maybe a position that's overlooked like outreach workers, we really need to do something to keep them in positions so that that knowledge isn't lost every so many years as they move on.
Thanks, Vanessa. That's a good point.
Thanks.
A living wage would be helpful.
So, what is up?
I just want to add to that, that one thing to consider with both peers and community health workers is not to mimic medical models of payment as in per procedure. We really need to pay people for the encounters, the body of their work as opposed to specific things in their work, because both peers and community health workers, they're meant to address a whole range of social determinants and all kinds of issues. So the challenge, I think, is to get the system, in quotes, to recognize the need for a more holistic payment approach, you know, the body of the work and not per procedure.
David, that's exactly right. That's exactly right. And when I see something like this that's asking for innovative ideas, I think you're right on it.
Thank you both. How's everyone feeling?
I was going to say that's really important because you said we have a rapidly aging population. Well, that rapidly aging population are raising their grandchildren. And there's quite a deficit between they're not computer literate, they haven't been to school in a long time. When they're dealing with their own health issues, and if the child has health issues, not having those people to help them navigate is really, we're not doing them a service. So that's a really important point, I think, to put in here, that because of our Appalachian culture, we have extended family, and because we have drug addicted and affected parents and things going on that we in Appalachian culture, you just kind of a family raises, whatever. We need to look at that way and navigate those people to help them do what they need to do.
All right, where does that leave us? Innovative care?
Leaves us with a lot of things, Jack. Yes.
I mean, home-based care, I mean, obviously that's what I'm gonna say, because home health, but innovative care as far as home health is using technology in patients' homes so that we can better monitor these chronic illnesses. Remote patient monitoring is something that I also feel very strongly about, and I think it's something that this community, no matter whether it's Garrett that does it, Mountain Laurel does it, if home health does it, if we all did it, it's more hands on those patients to chronically manage them, keeps them out of the hospital. They can't make it to their cardiologist appointment, but if we're sending vital signs to, down to Dr. Nelson after a post cabbage, I mean, he has that real-time data from the home. And then, as home health workers, we can physically go to the home, adjust medications, that kind of stuff is, I mean, huge. It's an innovative, remote patient monitoring is so innovative, and it's going to also decrease the cost across the board because it keeps them out of your regional medical center, keeps them at home. So the next one, telehealth, obviously.
We have three things to say indirect to her statement. So one, remote patient monitoring 120%, but it also needs to be school-based and library-based. St. Mary's County is doing an excellent job with school-based health centers because what they're doing is they're seeing the kids during the day, and then after, when the family comes to pick them up, then the grandma gets to go and everybody gets to go. So one single point of access is incredible. The second is the libraries. They're putting pods in their libraries so that people can go there and actually seek care through these digital means so that they can't get to, the centralized point of the health system. There's a way to actually get that. With that comes interoperability and data sharing, because we're all collecting data. But it's going to be important for us to get that data and share it across each other to really coordinate care for that patient.
Thank you.
There's one other parallel I just want to draw real quick, because I, like Ryan, have also been to quite a few of these sessions in other counties as well. But in Allegheny County in particular, I think they touched on something that they just captured really well. And they talked about the struggles of transportation constantly being on every single list, right? Every single time we have to talk about transportation because we still don't have it figured out. Mathematically, we probably won't ever figure it out unless our population quadruples or some other miracle descends upon us. But I think that they covered that really well in talking about, you know, the shift in strategies to figuring out how we deliver care where it's needed. So whether that's at the home, whether it's in a community center like a library or something like that, I think that that was a really good point. I think it's something that we already do. We just do it because we just roll up our sleeves where we need to do it, but we might not necessarily do it systematically. And a good example of that was, you know, because of the vaccination discussion, there was a lot of questions about whether or not the Amish community was receiving services. And we're like, oh yeah, we've got all of this stuff going. And nobody else in the rest of the state had any idea what we were doing with that. Even though I'm pretty sure Bob has had it in at least 3 different presentations that I've seen. They just didn't remember it. But I think that that's an important concept, is that, you know, we roll up the sleeves when we have to do it in an individual program, but are we thinking about it in terms of systems and how we deliver that type of care?
I think that also all goes together with the care navigation support for prevention. So if you're looking at, you know, school-based and access models, if you have that navigator, which we have some navigation services, but there are a lot of services out there that our patients and our residents don't know about. And I think that that's where we're looking at trying to, you know, focus on helping our navigators help patients prevent the chronic diseases, and how can you do that? Where can you do that? Where can you afford to do that?
Such rich discussion. And I really appreciate it. And we kind of are at the end of our time. So we do need to,
anything we didn't?
yes, is there anything we didn't cover?
Thank you guys for
Do
all
you really
the
want to
input.
ask Rodney that question?
Got another hour?
I know,
Yeah.
I know. It's, and you know, it just speaks to the collaboration we have for everyone to show up and to really use the knowledge and experience in the room and the way that you've dedicated your lives and your careers to lifting our community up. So we're really thankful. We're thankful for you. We're grateful for your ability to come and share the knowledge and your continued care of Garrett County and the people that we love and live beside, right?
Shelley, correct me if I'm wrong, but we can go back and do this form.
Yes.
If we're sitting here feeling passionately, or the team of people that we work with,
Yes.
we can organize that.
Please do.
Yeah,
We
we
would
encourage
like
you
you to do that. And we want you to share it widely. We want you to, and the time we have, it's open until,
Let's say like tomorrow.
The other thing.
Because I'm gonna have to get all this bundled up.
That is for our form, for our submission to MDH that we're required to do. But the State Office of Rural Health also has a form that you can independently submit your responses to it.
Yes, and I'm going to submit this real quick. Everybody online, I'm going to go back and put your comments in as well, but I don't want to lose this because I wrote a lot. So if like the internet or something goes out. So that, what Jennifer's talking about, is on our website. So all of these calls for listening sessions, you can find all of the resources on here. So there's the 2 public meetings, so the local management board, which we had last week, and then today, where you're currently setting or online. The public survey, which is what we filled out today, anyone can go out and do and, you know, write those things down. I would say we probably need to close that tomorrow so that we can bundle that up and make sure that we can get that in a nice little.
we do it in the day tomorrow.
I love working Saturdays. And then the direct submission was what Jennifer was just talking about. So this is the state's form. So you can actually submit specific projects. Their form is different than ours. Ours is about asset mapping and figuring out solutions. This is like pitching a specific solution. So it's a little bit different, but that is also linked on this page as well. And then all of the state's process. Sarah and her team, their whole process, all the other meetings, all that information is linked there as well. So you can do that. You can also see the slides at the bottom of here that they presented a webinar with a lot more information with the background about the one big, beautiful bill. So, all linked. Just look for the Castleman Bridge. We'll guide you home. Unless you live in the southern end of the county.
Do we have a few minutes to just talk about 360 Access Hub? If we do, we need to stop the recording. So we have to submit this. And so we're going to stop the recording and submit this part to our MDH partners. And then we will resume our health planning council meeting. And for those that can stay, we'll just have a brief update about the 360 Access Hub.
That isn't here. I'm afraid if I stop the recording, I might not be able to restart it.
Okay.
So maybe I'll just cut it. How about that? I'll just cut the recording.
Thank you.
So that we don't lose that.
Yes, we do not want to lose that. So
360,
I'm
right?
going to invite Lorena to come up with me. So I just want to thank you for coming all the way here. And I just want to, you can go ahead and introduce
I was in
yourself.
Preston County, so it wasn't that hard.
Okay.
Lorena Dion, the Senior Director of Population Health for Maryland Physicians Care. We've got an amazing partnership, I think, with the Health Department, the Community Action Committee, and I'm very excited about the 360 Health. So maybe you can share a little bit about 360.
So we've talked a little bit about it in here before. We had a listening session all the way back in January to get our community together. We talked a lot about food insecurity, the resources and assets that are here. And Lorena, Chris Millett from Community Action, and myself,
And John.
yeah, my team, really just got together. And because Chris had the location and Lorena has an amazing model and program that she's doing across the state, and we have some grant money and some other things that really brought together a catalyst of this moment in time where we could step in and create a physical space where we could address food insecurity differently in Garrett County. So it's not to take away from all the assets and the churches and all the services that are already here, but we did identify a need that folks just don't have a consistent way to get food. The need is increasing. So we've been working in the space for several years, the last year in particular, directly in food security, and the programs that we're running. Things are redeemed and cashed out within an hour of time where we put a food box out and vouchers and things like that. And so there's just really, really high demand. And so we really have been working together in partnership over the last several months to listen to our community. Lorena made a lot of good points in the last session. We're talking about rural health and what that looks like. And we want it to be community led. We want to utilize the strengths of our partnerships and then put those things forward. And so at the Access Hub, Lorena has a specific program that is successful across the state that we will employ here through 360 Access Hub. And then if you go to
Maybe I could share a little bit about the program that we're doing.
yes.
Okay. So we were lucky enough to meet an organization called America's Olive Grove that realized very early that food was getting delivered to their church, but people in the outskirts of Washington County couldn't get there to get food. And so we've been struggling with this as MPC. Is it cheaper to take the people to the food, or is it cheaper to bring the food to the people? And basically what Clint did, who's brilliant, got a grant and got a Penske truck, started delivering food out to the community members. With that being said, we, MPC, funded an expansion of this program, brought it to Allegheny County, and we are now have a food delivery program in Allegheny, Washington, Frederick, Baltimore City, Baltimore County, Montgomery, Prince George. We're about to have a meeting in Eastern Shore. And when we looked at Garrett, we said, man, you guys have great farms. You have great local resources. How do we do this and create a sustainable model? So we provided some funding to 360, and this was kind of born. And the idea is to start with having a centralized food hub, eventually get to a point where we can do delivery. What I can share with you is in Washington County, and because we've coupled this with workforce development as well as financial literacy, in Washington County right now, 65% of the people who go through the program are no longer food insecure after 3 days.
In Allegheny, we're up to 75% of the people. And part of it is our community health workers work with and the social workers work with our NPC members to put together a plan to thrive, right? I mean, my dream would be if we didn't have anybody on Medicaid, I'd be out of a job, but I'd be happy because that means that everybody would be thriving, right? So ultimately, we're trying to implement this model, and Shelley and John and Chris have been phenomenal partners. And so with the 360 Hub, we're looking at not only having a sustainable source, right, but also bringing in workforce development and seeing how we can connect with Habitat for Humanity. So we're addressing the whole person, not just one specific need. But when we look across Maryland, and y'all know we have 92% of the market share for Medicaid out here. When we look across Maryland, food is still the #1 need. And then it's housing. And when we talk about housing, it's really 4 categories: homelessness, housing disrepair, utilities assistance, and eviction prevention, where people are couch surfing and they're about a friend away from ending up on the street. So we really need to address food first, build the trust. Goes back to a comment someone made. You can build the trust with getting their social needs, then you can build the trust in engaging them when it comes to their chronic disease. And if we can't get this taken care of, it's going to be real hard to deal with their diabetes, their stress, and everything else. Thank you.
No, that was wonderful. Chris wasn't able to be here with us today. We have Regina on the line. I know she was joining us virtually. And so it really is a different approach to serving the population in a holistic way, as Marina said. And it's using food. That's how we're getting them in the door.
And there's a great kitchen. I'm hoping to revitalize, Greg, to do cooking demos. One of the other things that we found out across the state is people just don't know how to cook. I mean, they don't even know how to prep a chicken breast, because we become so dependent on processed foods. And especially the kids are coming home and eating Takis, how can we teach them to do things that are portion control and healthier?
So we've done several different beta tests and pilots throughout the last several months. We've worked with Garrett growers and other farms specifically to purchase a lot of local produce, curate meals, and serve not only food insecure folks, but nutrition insecure as well. And we hope to continue that model because we do live in a really unique area that does grow a lot of food. And so there's 3 different ways to get there. You can look at it on the website, but Lorena's program through NPC members, and then John and I and Kristen through Care First have some funding, and we're working with providers. We're going to be also collaborating with Mount Laurel and GRMC and ensuring that any licensed provider that's also behavioral health can refer into 360. And we're going to do some work as far as quantifying this. We've talked about that a lot in the Health Planning Council, quantifying what food insecurity looks like, ensuring that as many of our providers and agencies are quantifying it the same way, using a consistent screening tool, things like that. And so there's more to come there. And then, of course, community action has been and continues to be the designated provider for emergency food. So when we started this process, they were operating a USDA program called Groceries to Go. And Regina, you can speak up anytime if I don't say the right thing, but Groceries to Go. So since we've been working and trying to just work out all the kinks with this and utilizing the space properly, that program was cut. So they served 100 people. They had a huge volunteer base, and they had the backside of 360 West Liberty. It's the long cement block building. There's a garage door, and they had all kinds of pallets and infrastructure built to do that work. And so I went in and I was like, well, can we work together? I want the space. And it was distinct because USDA had so many rules and, it had to be a separate space. And so that program was cut, unfortunately.
Could you explain how it's cut? Who cut it?
So
I can jump in on that, Shelley, if you like.
Okay.
That program came to community action through the Maryland Department of Aging and their partnership with USDA. That transitioned at the end of September. September was our last month serving that program. MDOA has kicked it back to the Maryland Department of Health, and I believe that can be picked up by the local DSS programs. What I would just mention is we were sort of already experiencing some pain points along the way with the program. And one of the things we are excited about with 360 Access Hub is that food choice now becomes an option for someone who is struggling with food insecurity. It's not just here's the box, you get what you get. It's going to allow people to actually choose what they want to eat and really fill the gap much better. We do have an infrastructure of 20 to 30 long-term volunteers who have helped us deliver the food boxes to our low-income seniors who, you know, are mobility challenged. So we're hoping at some point we can flip that switch and engage them around the hub.
Thank you, Regina, so much for that.
The state reorganized who was gonna fund it, and the people picking it up haven't come in yet, said we'll continue it. We'll start all over again.
Right, but we're in communication with DSS. DSS partners with us at every distribution we have because we want to get people enrolled in SNAP, make sure their benefits are getting the most that they can. And so all of these collaborations are tight in our community, and we want to make sure that we're meeting the need that we have and we're willing to work together, whatever that looks like. And using the 360 Access Hub in Community Action's nonprofit status to be flexible in that. And having partners like Lorena with Maryland Physicians Care and the funding model that they have and the program that they are already doing all over the state helps us to know that we can be successful in these areas.
So that's actually an excellent point, is the sustainability of funding, right? You know, part of what NPC is doing is providing a nominal fee for everybody who's served from an NPC membership. And we do have some criteria on who can be served out of the 360 Hub and out of all of our programs. However, because it's a hub, and that's actually the buzzword, right? And you're addressing chronic disease, and we looked at the shifts that are currently going on with this administration. One of our partners in Baltimore County was just awarded $116,000 grant in order to hire somebody full-time to be able to take the program and expand it. They wouldn't have gotten that grant if they didn't have the food model already in place. So by putting a 360 resource hub in place, it's going to open up grants that we can apply to. Additionally, one of the things that we're really huge proponents on is improving the local economy. So in our Washington County program and the Baltimore City program, most of the food is getting sourced locally. So local suppliers, local farmers. We've got the Farmers and Hunters for the Hungry that are actually donating meat locally, which is a great organization. If we can figure out how to balance this and then provide the model of choice, we have less waste, which is ultimately what we need to do. And then we're coupling that also with SNAP-friendly recipes. So I know, Mackenzie, you met with Tara last week to look at how we can continue to improve the education across, even though your program is getting cut, you know, how we can continue to support that. So making sure we're all working together is going to be key for this.
I just have a quick question. Just for looking at like the population of 65 and up, do you see, oftentimes in home health, obviously we have occupational therapy go in there to assist them on light meal prepping and stuff, but some patients aren't even able, you know, to do that. They solely rely on Meals on Wheels, microwavable stuff, which obviously is not the healthiest for diabetes and congestive heart failure. Do you see a good amount of patients who are able to get the boxes and make the meal, the simple meal recipes that you guys offer?
So what I'll tell you is the Housing Authority down in Washington County has a similar situation. And because Clint and his team actually go there and deliver boxes, they were realizing that when they were delivering the next box, a lot of the people were not using what was in there. And that's where the choice model really came in and why we adjusted, right? The additional piece was assessing what cooking equipment people have. They were finding a lot of people in the Housing Authority were cooking out of microwaves. That's why we started the Meal in a Mug initiative, which was how do we teach people to cook healthy meals just using a microwave. But it's become an excellent source of communication, that box that gets delivered, and also the people who are talking, whether they're volunteers or they're part of the organizations. They're getting a lot of information. The other unintended consequences that we had two unintended consequences. One was there was a federal grant that allowed the libraries to deliver tablets and PCs, and they didn't have a way to get it out to the community. So the trucks ended up being a way to do it. And then most recently, during the floods in Western Maryland, we were able to pivot those 2 trucks within 48 hours, the ones that we have in Allegheny and Washington, and deliver 6,000 pounds of food to the local affected community. So that's actually where I'm heading today. We're still doing post-flood recovery and coordination of services. So there's a lot that we can do, right? Once you've got a model in place, and then you can adjust accordingly. But then we can apply for grants for people who are seniors who need, and again, Medicaid or MPC, we only serve under 65, but we care about the community and we want to make sure that we're getting what we need. Allows you to apply for grants. That'll get you, the supplies that seniors need.
And
I
the
hope that
other,
answers your question.
yeah, it was great. And there's more to it, but the other piece is that Community Action is our partner. And so they've been doing this work for decades. And so using their expertise and understanding their models and then tweaking it all, like Lorena said, and utilizing the funding we have to make sure we're trying to capture all of the need and the seniors that cannot struggle with dexterity and cannot prepare meals. So that is something that we are obviously working toward and considering. And so it all has to be done. We can't do everything at once, right?
Mhm.
So we're having a ribbon cutting ceremony. We hope you all come out to it. It's the 24th.
Yeah, October 24th.
At 3:30. And we just want, it's community led. And so it has been. We have phase 1, phase 2, phase 3. Of course, all of us want to start at the very end and have this fully operational, beautiful facility where we're meeting every single need. And this is not a reality. And so working a little bit slower, making sure we have sustainability models in place, doing it well as we begin, is really what we've been doing and working toward. And it's been amazing having the partnerships that we've had.
Yeah.
And we've learned a lot about one another and how we can utilize the strengths that we each have.
Yeah, I would be remiss if I didn't give credit to our Community Action Committee as well as the Health Department for one, trusting and being our partner. I will share that we have a similar project called the Food Project down in Baltimore City, and our colleagues got to tour that. And it started off by food. We now have, I think, 12 community-based organizations in the same space. They're starting the first daycare in the zip code. Recently, Safe Exits actually came, and they realized that there's sex trafficking happening in Southwest Baltimore that they didn't know about. And then we've got a community-based doula program that's starting to start educating the population because they're getting pregnant very young and they may not have the support needed. So that the grandparents aren't taking care of the kids, right? I mean, there's a lot of learnings that we have from the different programs across the state that we could bring to Garrett County. So we're excited.
Laura.
Oh, Laura, yes.
Yeah, I think you clarified it. Will the ribbon cutting be the official opening of the Access Hub, or is there currently distribution now?
So there are, thank you, Ben. I just want to point out that Laura has been one of the volunteers that have come out and painted and done a lot of the grunty, dirty work behind the scenes. We have several people through Judy Carbone's group, C-Works, and others that just show up and have done hard things that we haven't had to do to get the space ready. And so that's already happening. And it's been incredible to watch. So thank you for that, Laura. So the ribbon cutting is our way to bring it to the community to say, here we are. We have a few more nuts and bolts to work out. So, but we are serving people through there in the models that we are working toward, and it's by appointment right now. So the website is soft launched, it's live. We haven't done our coordinated communications campaign or anything like that, but we're taking the steps, and we wanted just to invite everybody to get on board, learn more, give us feedback. And so that date will be coming soon.
We did start in June. We served 10 local families, and that was a soft launch to kind of get our feet wet, right? You're gonna fake it till you make it. And Shelly's done some distributions. We're looking to do some holiday distributions with Nourishing Neighbors as well. However, we just did a consulting. We had Clint from America's Hauling for Hope come up on Monday. DC covered the cost of doing that to really set up the pantry to be able to serve the broader community. And we were just told that we're getting that whole back space,
right?
Which
Garrett,
huge. We went from being in a small environment to now having this massive area to be able to sustain a pantry. Our goal is to serve about 250 people out of the hub a month.
Will there be opportunities for volunteering? I guess that was the second.
Yeah. But I just said, there's a couple of things you know, as we're standing this up, the staffing was part of the issue for us. John and I cannot have another job. And Lorena can't be here to run the pantry and Chris. And so we have Miranda Bauman, who is from Community Action, and she will be leading the operations of 360 Hub. And then in the audience with us today, we have Kristen Coddington from our team, and she will be helping to service and be front of house. And if you go to the 360 Access Hub website, there's a /volunteer section. There's an online training that we're asking people to take and a questionnaire and asking you to join the 360 Access Hub action group on My Garrett County and collecting our volunteers that way. So we have an official volunteer process, and there will be many opportunities to come together and serve our community.
And MPC has committed a community health worker to staff part-time up here, as well as our social worker. I just found out last week I'm getting additional staff. So
Great.
most likely I'll have a permanent person in Garrett, period. So,
and this is evolving, and we also work with other partners, as Lorena said, to figure out who we need at the hub when.
Yeah.
And the navigation and DSS and just all these different things as we begin serving. We'll figure things out as we go. So there's a lot of room for our partners to serve because we're all trying to do the same thing with the same population.
it's not going to be perfect from the get-go, right? I said, we're going to fake it till we make it. So we really need your help in helping us make this successful, because I think it'll be a huge game changer for the community.
And relating to enrollment, you will receive a heavy amount of emails from me when that process begins to make sure that we can really permeate that. Because like Shelley says, you know, this is live. We're most of these services have not actually fully started yet. But like, for example, like the Healthy Together, the meal box distributions, like we are doing several different things. We've had the test pilot site in PC. So there will be options down here to enroll in even more programs, and we will be doing heavy marketing on each of those to make sure you know, like from your perspective, if you are any licensed professional, so that could be medical, could be behavioral health, anything that meets that requirement within our grant. So we'll clearly communicate all of that. And then the other thing that I just wanted to make sure that we did mention and just thank is
Hang on, John, because that MPC referral link is live. So if you have anybody who is MPC and you need to refer them, they'll be connected immediately with the community health worker or social worker, depending on what their needs are.
Yeah. And if you click on these, it'll tell you what the current status is. So some of them are operational, some of them are still onboarding. But I just wanted to mention, and by the way, there's also a partnership with the school system I think is super critical in teaching people how to do things and how to prepare meals. But I just wanted to also thank the local management board for the grant that they provided to actually help us stock some of the essentials in addition to the locally sourced items. Because we do know that there's all kinds of different situations with folks who may not have any cooking utensils at all. So we're really trying to cover as many bases as possible. But the local management board also stepped in a huge way and helped provide a lot of that so that we could just start some of these distributions. And it's also been just a really big help because like we've even had individuals that showed up and we had to figure out how to deal with that because the hunger issue is so pervasive at the moment. That this really is a huge blessing for our community to be able to tap into that. So I also just wanted to thank the local management board.
All right.
Any questions?
Any questions or any other? Hope to see you all out there and joining us, and you know, a really exciting opportunity.
When's the date again? So
The 24th of October.
It's Friday.
Friday, 3:30 with the chamber.
Okay, thank you. Lots to think about and act upon. Our last topic is the agency updates, and I'll start in one side here. Anyone have an update? David? Online? David?
Yeah, I have two updates. I'll give you the good one first, which is the Healthy Together program. CHRC just did their annual review for us, and they are very happy. And we more than doubled our first year goals on the grant. And I want to just give a shout out to Garrett County because it really is the partnership in Garrett County with social services and the health department and Mountain Laurel Medical Center that have made us so successful. So a huge thank you. We more than doubled our goals. And then just so folks know, we're branching out with the Possibility Shop concept. We are in the same building as the 360 Food Hub. We're up where the Atlantic Broadband or whichever they were, the internet company used to be, on Tuesdays and Thursdays. So that's kind of like a little resource there, focused primarily on issues of substance use. We have peer recovery specialists there. So Healthy Together, all kind of good stuff. The Connector program, the health insurance world, Maryland Health Benefit Exchange just cut the program by 2/3 statewide. And what that means is that there are significantly less navigators across the entire state. What I want to put a shout out to Mountain Laurel Medical Center, because Garrett County will have more navigators per person than any other county in the state because of Mountain Laurel Medical Center. I'm going to have, as it stands right now, I'll have one navigator for Allegheny County and one for Washington. So it's going to be a bumpy ride because, just so folks understand, premiums are going up quite a bit. And in Garrett County, the cost for insurance that will get you to Morgantown is going to be very expensive. And I know that's a priority for folks in Garrett. I'm talking about the private health plans here. So just know that it's a rough ride in Maryland Health Connection world right now on the marketplace insurance side.
Thank you. Anyone else online? Okay, seeing no one else, we will close the meeting. Just a reminder, October 23rd is our next meeting, which is also the Garrett County Board of Health meeting. Thank you all for coming.
I'll still be there. Things happening in your life.
Yes. Thanks, how are you? Yeah, I didn't really go for it. Actually,
Yeah, well, and let me tell you, when you talk about access, when you talk about internet access and things like that,